Okay, so we are live, folks. It is an updated addition to the previous video that I prepared on the COVID-19 and its impact on dentistry. This is going to be a little bit of an update because although the last one was on Sunday and we had a number of recommendations and talked to several people for you, things have come along quite a bit, and I'm just going to quickly show you where we are with this virus and the problem that we're dealing with here. And we're talking about where I was when I talked to you guys back in Sunday. We were dealing with a infection that was spreading fairly fast. 162,000 total cases had been discovered on that Sunday when I talked to you. And now we've moved on to 267,000 cases. And as you can see, the numbers have dramatically increased since, and this is just last Sunday, and this is now quite a bit of change in our perspective on this virus growing fast. And here in the US, we've been trying to have containment, but there is obviously some challenges with that given the numbers and the growing number of cases. So this is a little quick graphic showing you, based on the New York Times graphic, showing the amount of risk based on the professions. And as you can see here in the upper right side, actually it's kind of blocked by my image here, but just where you can see me right below me, that's where dentists are. Dentists are one of the highest rate of exposure potential. And the main reason for that is because we're dealing with a deep respiratory tract infection, and those types of droplets and viral load that you can find are found obviously in the mouth, in the saliva, in the tears, in the areas that we're working with, and potential creation of aerosol from our handpieces and the work that we're doing can cause problems. Of course, there are ways we can kind of limit this exposure by making sure we do our testing and doing the temperature test of fever on patients, asking the appropriate questions before the patients come in, check their temperature at the office, have them wash wash up their hands and their face before we see them. But we're talking about not so much patients that have symptoms, but those patients that are right before developing symptoms, at 1 or 2 days before symptoms are developed, where they could potentially be infectious and they end up seeing us. If any patient clearly has any symptoms, they're not to be seen in a dental office because of the fact that we don't have proper PPE and enough gear to deal with that particular types of patients. So as of March 16th, the ADA, right after our little last video that I made for you guys, the ADA called out to dentists to close up their offices and limit their practice to only elective procedures for the next 3 weeks. And that's ADA statement you can find at theada.org, or follow this link at bit.ly/2VQ6BHU, where you can go in there and read in detail about that. Now, OSPAS or OSAP, which is a infectious disease and controlling the infections in the dental office journal and resource, has also made their membership kind of available to dentists as a kind of open platform. You can check that at the osap.org as well for some of the requirements for OSHA standards and things like that that you would need to follow in order to better protect yourself. CDC and OSHA are also additional resources at osha.org that you guys can go to deal with proper gear for limiting your exposure to the virus. Again, I want to emphasize, if you have patients that have active disease, they should not be seen in a dental office. As in elective procedures, no one should be seen in a dental office for the next 3 weeks until we get some more clarification from the federal authorities. And as far as emergency patients are concerned, again, patients that have symptoms should not be seen in a dental office unless your office is certified, OSHA certified, to deal with these types of highly infectious patients. So check all of those things out. But the one thing is to deal with the medical aspects of this disease, and another is dealing with some of the ramifications of closing offices. Again, the situation is very fluid, and what I'm telling you right now, as of the Friday, This is what stands here in the US, and in Massachusetts, Boston, Massachusetts, things could change very quickly. There could be a very quick declaration from the authorities to force a shutdown by the public health department to shut down dental offices. And that's a key thing to keep in mind. So I'm going to try to have updates as soon as they come up for you. But at the present time, there is no mandated closure. But it is wise for all dentists to completely limit their practice to some cases that are absolutely necessary to treat because they can't be seen, and limit the amount of patients that come in at a time. But from other perspective, which is that of accounting, if you will, and the business aspect of this problem that we're dealing with offices being now shut down for a week and having another 2 weeks to go through, I have a guest, which is Mr. Mark Rosen, and Mark is here to join me from Rosen Associates, which is a big accounting firm specializing in dentistry and dental customers, if you will, to talk to us about this particular impact of the coronavirus and the closure of dental offices on their accounting and essentially everything that owners need to know about it. Mark, can you hear me?
Yes, yeah, thank you very much for having me on.
Absolutely, Mark. Thank you so much for joining me. I know you're a busy man, and especially around the, coming up April 15th with the accounting and the taxes dates, which was just announced to be deferred. Thankfully, yes. You're pretty busy. I just wanted to ask you a couple of questions regarding the impact of the business impact of this virus on dental offices and the various things or maneuvers that dentists can take to address cash flow issues for their staff, dealing with staffing problems, and any other general advice that you may have as an experienced accountant in this firm with lots of offices under your belt here and lots of experience locally as well as nationally. So I'll be curious to hear your feedback. So go ahead, tell me what you think and what you recommend from business aspect.
No, thanks very much. Obviously, different times for everyone now, calling for different measures. Right now, though, as you said, they just announced that the filing deadline moved from April 15th to July 15th. That goes along with and aligns with the payment change that they've made a couple days ago. So now, the April 15th deadline has now fully moved to July 15th deadline, and your payments are now due at that time. We're waiting for guidance in terms of estimated taxes, but right now your estimated payment would also be due that July 15th deadline. Other items that are typically due April 15th, like a retirement payment, we don't know this yet. IRA payments, we're waiting on guidance for that. But in terms of cash flow for the practice, so at this point, many offices throughout New England, throughout the country have shut down. Are now doing just the emergencies as you had discussed. So a couple things I would do first. If you have any loans on the books, you should immediately be calling your banks. Several banks are doing different programs. I have heard everything from 3 months of no payments at all, totally deferred, to 3 months of interest only, to a potentially even 6 months. So you really want to make sure you speak with your bank, find out what they're offering. So along those same lines of cash flow, we want to look at what are our big expenses, right? Our big expenses are, or our big cash outlay. I don't want to use the term expenses, but our big cash outlay is the loan. Speak to the bank. Your rent. Speak with the landlord, because what they're doing is they're most likely speaking with their banks to try to get reprieve also, and hopefully can in turn kind of have the ripple effect down to you to possibly delay or make a rent payment smaller in order to push that a little bit down the road. Credit cards, okay? You've charged a lot on a credit card, and ideally maybe you paid off every month, which is excellent. But recently I just spoke with my credit card, and they're able to do a 0 minimum payment with 0 interest. So it's giving me the flexibility to stretch that payment out, make a small payment if I want to. So we want to make sure we take a look at that. Now, the biggest asset that everybody is concerned with, clearly, are their employees. What do I do with them? And that's a great question. I'm not an employment lawyer, okay? I've obviously been reading a lot about them and speaking with a lot of them. But right now, based on what we understand, we've read in the rules, is between now and April 2nd, you can choose to do what you want with your employees, especially in Massachusetts, but you can choose to do what you want with them because the new law, the family medical leave family sick leave rather, gets enacted on April 2nd. And at that point, the sick pay and other type things begin to kick in. I'm encouraging my clients to really step back and look, where do you want to be on the other side of this, right? You want to treat your employees well. Many people have suggested going on unemployment, and I agree with that a lot for these 2 weeks. But there's still a lot of uncertainty to, if you go on unemployment, a leave of absence sort of retains them, in Massachusetts I'm speaking about, retains them as an employee, but hours have now been limited. Whereas a full termination is just as if you normally terminate someone, which you pay out vacation and pay their last paycheck and all that stuff. But I think being transparent with them, they understand the position you're in, and they may be able to get sick pay come April 2nd. We're still waiting on additional guidance, and the government is hopefully going to reimburse the employers. That's what they're shooting to do.
Yeah.
The goal is beginning April 2nd, those that are still employed could be eligible for a sick pay, meaning if your office is closed and you're home with your child, you may be you may have to pay, if you're the employer, $200 a day, up to 10 days, or potentially even longer, up to 10 weeks, actually, if the office is closed. But if you're sick, you may be due about $511 a day. But we're still waiting on guidance as to the reimbursement for the employers for that. So that's really important. From a tax standpoint right now, those are ideas where we can save cash. But if you are a S corporation, okay, you are an employee of your own office, okay, you should be stopping your own payroll if you can. And the reason for that is you want to stop your Social Security and Medicare payments for now. Cash is king, as we talked about. I mean, that's what everyone needs. You need to learn to leverage it and stretch as much as possible. So working with your vendors, but it's very important to keep your team members that are valuable to your practice. Whether it's your lawyers that need to work through this, whether it's your accountants, or it's your office manager that you need their help in rescheduling the patients, you may need to continue to pay them the best you can to keep the advice coming and make sure that you don't eliminate the things that really can help you get through this. But from a tax standpoint, if you're looking at your 2019 tax return, which is now pushed out to July, and you were looking at a potential refund, that's something that you want to get filed as soon as possible. Take all the deductions you possibly can for 2019, and let's apply them. We'll apply them. We'll do a better job of tax planning for 2020, right? We'll deal with that later, but for right now, we need cash. So let's get the return filed quickly, get it into the government, and try to get that refund back, because that's only gonna be helpful. So overall, I mean, I would highly recommend, if you have obviously employees, you're not sure what to do and haven't gotten advice from your advisors, speak with an employment lawyer. There are some great ones out there that have been following this to the T. I would definitely touch base with your accountant regarding the deadline and what needs to be done by then, what payments can be delayed, and even if you think you're going to owe, how much, right? We need to get that. You want to get that idea. They did push the deadline, but you really want to get an idea of what bill you have coming down the road. And then I just want to definitely put a little plug in here. So on my website, rosendentalcpa.com, you can sign up for our newsletter. You scroll down and sign up for our newsletter. We've been putting out updates as soon as we possibly can, kind of regarding all this stuff, and hopefully some suggestions of what you can do. So those things, I mean, keeping an eye on all that stuff, leveraging the cash as much as possible, reaching out to your vendors, working with them, seeing what they're able to do, and taking a look and seeing this will end at some point. So how you become more efficient. The one other thing I will say, I'm sure this is a great time that you have outstanding claims out there for insurance companies that you haven't gotten yet. There are great companies that are still going, that do outsourcing. If you're not sure you're collecting everything you can speak with them. You're happy to get in touch with me, and I'm happy to point you in the right direction there, or just begin a good time to go through your claims with the insurance companies. and see what isn't filed right and what you can still collect. So, really appreciate you having me on.
No.
What other questions would you have for me? Anything else?
No, of course. No, I mean, these are all great advice, Mark. So to just kind of quickly sum it up, what you're saying is, I like the advice of maybe calling the paycheck company and if you can afford it, to cut down your own payment, because dentists usually should be having enough of a kind of a rainy day fund that they could support themselves. But since cash flow is so important for the practice, maybe you can call the paycheck company and reduce down your own paycheck at the end of the month so that you can have enough cash. And then the way you decide to work with your employees, in my opinion, is obviously, as you said also, and as a famous quote by Simon Sinek, is that you gotta, leaders eat last. You gotta need to kind of make sure that you lead by making sure your employees and the people that work with you are taken care of, and that they would be more loyal to you, hopefully, on the other side of this, when we will eventually come out of. Absolutely. I mean, there is an other side. This is, I don't want to say this has been overplayed, but it's certainly an important factor, but it's not the end of the world. It's, there's going to be a time after this when, whether it's going to be by herd immunity, whatever is a vaccine or just the recipe of the medications for it, we are going to get through this all together. What's important is the way we go about it through this process, so that we make sure that we don't, lead or actually leave behind a wake of all kinds of different problems and damage our relationships with our staff. Those valuable ones, as you said as well, it's so important to keep track of and maintain. Speaking to an employment lawyer would be an important one, as you said. I'll probably speak to you about that as well later on. And overall, I guess stay optimistic and positive, but know that you need to have a good contingency plan for the office, and that you are able to maintain the status that is also fluid and changing at any point in time for just a little while longer.
Touch base, make sure you're in touch with your advisors, and making sure for each specific situation is a little bit different. So just make sure that you're reading the general advice and the guidelines, but then you're working with your advisors and making sure that you're working as a team together and continue going, so they can provide the best service for you too.
No, absolutely. All right, well, Mark, I know you're busy getting back to things. Thank you so much for your time and your expertise. And anyone who has any questions, you can contact Mark at the Rosen Associates LLP. And thank you so much again. Have a great day.
Take care.
Bye-bye. Bye. Okay, so, all right, guys, let's get back to things. And what we are going to do now, just quickly give, as I mentioned, so what has happened since then is, since the last time that we spoke, is we now have a situation in which closure of the dental offices is highly recommended by the ADA. We don't yet have a Department of Public Health just making a blanket statement that the offices should be definitely shut down for sure. But I think as an overall part of the community, and our priority being the making sure that the virus is not is contained as much as possible and the rate of growth is slowed down to the extent as possible, our duty is both to ourselves and to the family to reduce exposure for ourselves and to our patients, as well as reducing the potential for our staff to get infected or passing the virus in the community. Those are all important things. Again, in my practice, what we're doing, our protocol is to make sure that we have a thorough interview over the phone first. If a patient is calling in for an emergency, we're going to try to see if we can somehow manage them for the next 2-3 weeks until we have more information about the virus and the proper recommendations by the American Dental Association and OSHA, so we can get enough PPE and personal protection that we can treat patients. In the meantime, triage, as done by your front desk at the phone level, is going to be critical. Only get in patients that are absolutely positively need to be seen in severe pain and are not able to withstand and have no symptoms other than odontogenic symptoms. They should not be having any symptoms of a cold or the flu, any fever, coughing, sneezing, any of that stuff. And the main reason for that, again, is not only we want to reduce community spread, but also we are not equipped in most dental offices at the present time with adequate shielding and personal protective equipment with masks and so on, so that we can reduce the potential exposure and the droplets and the aerosol that's created during the treatment. Again, when it does come down to it, for normal patients, we shouldn't be as fearful as long as they have no symptoms. And it's absolutely necessary to do the procedure of a pulpotomy or pulpectomy. Don't spend too much time. Don't have to do a whole pulpectomy. Just do a pulpotomy, calcium hydroxide pulpotomy, and close it up and have the patient come back in 2 to 3 weeks. Most patients, once you do a pulpotomy, and just maybe take care of the larger root if you have to, if it's still after the pulpotomy, it's still bleeding quite a bit, take care of the largest root, which usually would be a palatal root or a distal root, by taking in a 2506 file, rotary file in there, and just taking it down halfway to a quarter down to 3/4 down to your estimated working length, and then putting calcium hydroxide there, and then telling the patient that it will be sore for a few more days and then it will get better, would be very helpful. At the same time, I don't want to advocate that you call and give prescription for an antibiotic to every patient that calls with pain or signs of pulpitis, because that has, again, its own chance of getting abused, especially with the new little kind of blurb about the Z-Pak and azithromycin potentially being helpful for the symptoms of COVID-19. I can totally imagine that people are going to be calling and asking for azithromycin left and right. Just make sure that we're not also just overprescribing antibiotics, because that has its own little side effects. I was going to go over the virus again and all the new findings about the way how the ACE2 receptors on the type 2 pneumocytes are affected, and how that causes the breakdown of the consolidation of the lung with the creation of all kinds of cytokines. By the way, meanwhile, write down any questions you have on the right side of the menu, so I can get down to them in a second once we talk about it. But what's interesting about this, and as we mentioned before, our goal here is to flatten the curve here. And that does come down by reducing our community spread and exposure. So we need to reduce the contact, but and having a contingency plan and dealing with if you get sick or your staff gets sick is going to be very important. But as I mentioned before, we're dealing with two different things. One is COVID-19 and the other one is COVID-19 hysteria. It's also important to stay positive and stay upbeat, because I'll tell you, the joke I was telling somebody lately is that the risk of death by coronavirus is going to be 20%, but the risk of death by the cabin fever is going to end up being 98%. So many people are being confined into these small spaces, and the fear and the pressure is just causing people to act all kinds of irrational ways. And it's important to kind of keep a sound mind and work effectively together in a positive way, and try to keep things upbeat. This will get over this. There's no question about it. People have gone through much worse things than this in the past. This is going to most likely go away in a few months once there is either herd immunity or there is some kind of a, either a treatment or somehow a vaccine that's going to be accelerated, that's going to come out. But what's important for us to keep a good positive attitude moving forward. Again, what we do in my office is now we've kind of terminated completely all elective procedures and most really, low-level emergencies. But if somebody has a serious emergency and you and one staff member can go to the office who is well equipped, if you have proper equipment and proper shielding, and do your procedure. Again, you check the patient to make sure they're not coughing or sneezing, and then you go ahead and do the test. Once again, it goes back to what I said. Look, we are in the healthcare business, for better or worse. I know some of you guys have said to me that, we have to shut everything down. Look, if you wanted to shut everything down, if you were afraid of dealing with disease, you maybe should have been selling pizzas rather than doing dentistry. Dentistry is a healthcare profession. You have an obligation to your patients, and I hope that you guys are all on board with me in terms of our ethical obligation. I went to the office yesterday and the day before every day for serious emergencies that the patients had. And I can't tell you how happy and how grateful they were, because they're not patients they're coming in on their own will. These are patients that have no other means of dealing with the pain that they're dealing with. And I know some of you out there have said that, 99.9% of dental emergencies are not emergencies. But in a busy dental office, even if 99%, even 1% of patients are still emergencies that you're going to have to deal with. So just be on on top of it in dealing with those. Measure the vitals and the temperature, and then move on with that. Again, using the rubber dam in our field for endodontics is going to be very helpful. And if you're not doing a non-endodontic thing, of course, you shouldn't be doing anything that's non-endodontic, because frankly, nothing that's non-endodontic is really that an emergency, at least for the next 3 weeks. Oral surgeons would be the other people that obviously have to deal with all kinds of abscesses and large things that need to be drained in those situations. But rubber dam, in the case of endo, is absolutely even more mandatory than ever before. Put that on right away at the beginning. Have them rinse with hydrogen peroxide, 2% hydrogen peroxide, or 1% hydrogen peroxide. Actually, 0.5% has been shown to be effective too. Even 1% hydrogen peroxide for a few seconds would be helpful in reducing the viral load as well. So, and also make sure that you do follow up and do a follow-up with that patient, because you want to make sure that that patient does not end up having symptoms. Because if they do, then you need to quarantine yourself, clearly. Because we're really talking about patients that you're going to be seeing on an emergency basis that are in that small window of time, about a day or two before they have gotten the disease and before they have symptoms. And that's the key thing. And although some patients may have the disease without any symptoms at all, those are the minority that have no symptoms at all. Most people would have some kind of a dry cough or a type of a fever. But what I was talking primarily about the hysteria that's associated with this disease is the reality that it's almost like the disease itself. What actually kills that's arguable whether that percentage is about 2% or 4%, or in fact, probably more likely less than 1%, as it seems to be now the consensus based on most people. And the reason for that is because the numbers in Italy are skewed, because most of the people that are coming in and are dying are also the non-healthy and people that are having the symptoms. Many of the asymptomatic people that haven't been tested are not part of that denominator of that equation that'll tell you what is the total number of cases, so that you can have a proper case mortality rate. The case mortality rate will probably drop as we get more testing. And it may end up being just, as opposed to be 20 times or 30 times more than the flu, it may end up being maybe 6 times, 5 times, 6 times, or 10 times more than the flu, which is still high, no question about it. But we do deal with the flu on a yearly basis, and we still are around talking about it. So I want to make sure everybody does not conflate the fear with the reality of it. The other thing that's important to know as well is that the way that this disease, almost like the H1N1 flu, kills is through some form of a cytokine storm, because as the type 2 pneumocytes die as a result of the infection with this virus, they create and they release interleukin-6 and IL-1 that causes the fever, interleukin-6 and the tumor necrosis factor alpha. These two factors do increase the inflammation in the area. And in fact, it isn't so much the virus that starts to cause the interstitial pneumonia and the consolidation of the lungs and the comorbidity that's associated with it. What it is essentially our own immune system's overreaction to all the cytokines and cytokine storm that is occurring as a result of it. And to take that analogy one step further, I just want to say that we want to make sure that our reaction to this disease is not going to cause more problems than the disease itself, both economically and psychologically, for ourselves and our patients. So as I mentioned also, I was talking to Mark a little bit earlier on, the true price of leadership is the willingness to place the needs of our others in front of our own. So that's something important that we all need to pay attention to. That is what our obligation is to our staff, to take care of them. If you own the practice and you're trying to move on, it's our obligation to our patients if they're in dire pain and they need treatment. And it's our obligation to our family to make sure that we stay healthy, to be able to be with them and to not pass it on to them, and so on and so forth. So balancing out these three main factors here is going to be the essence of leadership. And those people who can manage this effectively, stay sane, be able to lead their families, lead their staff, and lead their communities to the extent that they can be of a resource and of help to them psychologically, physically, or maybe even financially, are the ones who are going to come out of it unscathed and probably in better shape. We should not let a little virus like this otherwise be the end of our relationships overall with people. So it's the first day of spring. And on this first day of spring, I hope it's going to be a case of rejuvenation and renewal for all of you. I want to wish you all a wonderful spring and summer. I know it's going to be tough at the beginning, but everybody just hang in there. Things are going to get better. As we have seen historically, it does get better. So in the meantime, let's manage things. And let me get to a couple of questions here. There have been a bunch of stuff here I haven't seen. Talking about sodium hypochlorite and COVID-19, it kills the virus at very little concentration. Yes, sodium hypochlorite, actually, I think I read even somewhere that the Dawkins solutions, which is very little concentration of less than 1%, is able to kill the virus. What's great about these coronaviruses, and what we're dealing with is the COVID, this actually is SARS-CoV-2. So we already had the SARS virus. That was well contained on time, so it didn't become such a pandemic. But this is just the second version of it, CoV-2, coronavirus 2 for SARS. There's the envelope of the virus, which is a lipid kind of an envelope, are very susceptible to detergents, and that's why bleach and even soap is all we really need. And as long as you're not in direct distance of someone coughing in your face, the chances of you catching it is not as high. It isn't airborne like measles, where it would be traveling in the air in the operatory and you just breathe the air and you'd catch it. This is inside the particles, inside the droplets of the respiratory tract. And so when the droplets actually settle, they end up on the ground. So let's see here. What else is the question? So bleach is good, but don't use it excess. Don't be crazy and buy like gallons and gallons of bleach. Let everybody have some, I guess, right? So I've heard that the NSAIDs such as ibuprofen in daily dental practice to cure the symptoms of COVID-19. Yes, some people have talked about the use of ibuprofen in early stages of it being a problem. The same way we've always known in the past that in some people, some of the anti-inflammatories such as aspirin and things like that could cause problems with viral infections. This may be the case in this particular disease as well. Although what we know is later on with people that have the respiratory, the acute respiratory syndrome, in those patients, immune suppressants end up working well, which is part of the reason why this malaria medication has been shown to be helpful, this cocktail of malaria medication. And that's because, as I said before, part of the problem with the disease is not so much the virus itself, it's our own immune system's overreaction to it. So if you have your immune system is going to create this serious reaction to it, you'll end up having more lung damage than somebody who's going to have a more tuned immune reaction. Can payments be delayed? Dentistry 101 asks. So there is different, as Mark said, there are different ways to deal with this. You can furlough your employees, which is to kind of put them on a leave of absence, layoffs, or just best way would be to communicate with them to see what their personal needs are and what can you deal with in terms of their financial situations. How can you help them to get over this until things are, on the brighter side? And those employees that are more kind of irreplaceable, the irreplaceability factor of any employee is really what makes them unique and important. And people that are going to hang by you during this crisis are the ones who are irreplaceable, and you should take care of them. In terms of payments to different sources, as Mark said, what we can do is you can call your landlord, you could call your banks, any of those things that you need to do in order to postpone payments. Many people are going to be able to do that, and there would be hopefully some resources through the government that's going to take care of that. So happy to said there are no symptoms in the incubation period. How would you know if patient is infected or not? Better not treat if not an emergency, isn't it? Yes, exactly. If patients have no symptoms and it's not an emergency, you should not treat them at all. We're only talking about patients that are emergency patients that you really have no other way of referring or sending away and you need to treat. I mean, what are you going to tell people that are in dire pain, that haven't slept for 2-3 nights? You can just say, sorry, I'm not going to come in. At the present time in the US, there's still not a shutdown by the Department of Public Health. Because imagine, people in hospitals are going to have to are dealing with these things. You're in the healthcare business. We need to deal with the true emergencies that we have to deal with. If you don't have any personal protective care, you may want to find out an office nearby that does have PPE, personal protective equipment. But patients that have no symptoms, you don't have to treat at all if they're not emergency. If they're emergencies, then obviously you have to make sure if they have symptoms, then they need to be sent to treatment centers. But if they don't have symptoms, the risk is small, and you just have to do your best to deal with those. The risk you're taking. You're taking a risk when you're treating patients on a daily basis. You were up until December of last year. You were treating patients that have flu and had all kinds of things, and you weren't even thinking about it. Again, the death rate of the flu was 0.2%, and if the death rate of this thing ends up being 0.6 or 7%, unless you were not treating patients who were asymptomatic flu patients in this sphere, we need to kind of put things in perspective. Does 0.6 differ from 0.4? When do you use each? I don't know what you mean by 0.6 versus 0.04. This is Dentistry 101 asks that. Single aerosol could infect the whole staff and next emergency patients too. Again, happy to talking about aerosol. Clearly, aerosol is the main reason why dentistry is one of the highest risk professions in doing this thing. And you would be using a rubber dam. Once you have a rubber dam in place and you've used alcohol to wipe the inside of the rubber dam, the aerosol you're producing is not aerosol that is touching the patient's saliva. The aerosol you're producing is aerosol that is touching the patient's tooth surface and the pulp. And so you're not getting an aerosol with saliva in there. The aerosol that you're getting is without saliva. So that would be a different story. If you're not using a rubber dam, clearly that aerosol would be problematic. So I wouldn't recommend doing that. So how about mouthwashes before treatment? Iodine, Listerine, or chlorhexidine? As I mentioned, I don't know about chlorhexidine is not shown to be that effective. Listerine, I don't know what the alcohol concentration on that is. Alcohol concentration should be around 50% supposedly to work. So maybe a couple of tequila shots, rinsing, gargling, and swallowing could help everybody. Maybe one for the patient, one for you. Just kidding. Okay, and prevention is better than cure in Vietnam said. I agree, prevention is always better than cure. That's why we're taking the next 3 weeks off and treating only absolute emergencies that are asymptomatic. Until the situation is fluid, my next update might be the fact that Department of Public Health has come and told us nobody can be seen. Of course, at that point, they're going to have to figure out what they're going to deal with these patients that are in pain or may have, Ludwig's angina or all kinds of different abscesses that are not going to be able, people that have endodontic pain, they're not going to be able to wait 3 weeks with infection. That's just ludicrous. That is not going to happen. So there's going to have to be a better solution than what we're told. So happy spring. Yes, Dentistry 101, happy spring. The weather's going to be nice and warm today here in the Boston Common. I can't wait to go out for a little walk away from everybody else with proper distancing and not touching anything. Last time I talked about this little technique. Believe me, this technique, if you're going out there and working, works beautifully. All you need is just one little glove. Let me put this on, actually. All you need is one little glove. That's it. If you go out, you're touching anything, your dirty hand and your clean hand, right? Your clean hand handles your phone, your keys, your everything that you're doing. You could even scratch yourself if you're outside. Who cares? Your right hand is the dirty hand. This one is going to be touching doorknobs, open things up, close things up, touch things. And then later on, if it's a glove for you guys, you can just dispose it. You can even kind of wash it and then invert it and then rewear it again and then wash your hand underneath there. There's so many different ways. We can get rid of this problem if we're just kind of a little bit smart about it. We all get proper infection control protocols. Remember, our universal protocols are good for most of these diseases. Of course, in terms of the masks, we need to have shields. We've always needed shields. If you didn't wear shields before, you weren't practicing at the level of the infection control. You need to now have better shields, I guess, and the masks to have an N95 level of porosity. But the key with that thing is that, again, as I mentioned, there are other studies that have shown that the N95 versus a conventional mask did not increase or decrease, rather, the rate of flu transmission in a number of people. So last Wednesday afternoon, and I'm starting to feel a lot of pain in my body, head and joints. Greenzo says that it had a patient last Wednesday and is starting to feel some pain in the body and the joints. I hope it's just the flu. Yes, I certainly hope it's just the flu as well. And don't necessarily, I mean, you know, a lot of people, remember when you guys were in the medical school and learning pathology 101, remember you would read about a disease and then you basically end up having every single disease after you read the symptoms and the pathophysiology of it, because you were kind of thinking it, you were living it, and you were like, oh my God, is my throat now hurting? Or is this is hurting? Or is, you know, am I having this disease or that type of cancer? So hopefully that is not the case. But clearly, wherever you are, Greenzo, it's a good idea to get tested. Was about rotary taper. You said that when doing... Okay, so Dentistry 101 was asking about the taper. I had mentioned for emergency pulpectomy to use a 2506 rather than 2504. When do you use an 04 versus an 06? So that's a good question. You can actually, you know, a good emergency protocol would be to just kind of combine a 2504 and a 2506. 2506 will do a better job of removing all the filed remnants, or if you were shredded pulp remnants on the canal walls coronally, where it's the largest. And then the 2504 can go a little bit deeper. So you can go back and forth between, if you want, either a 2004 and a 2506. You just go back and forth, and the 2006 will go a little deeper. 2506 will remove the coronal part. And that you don't try to go all the way to the apex, to likely to where it goes. As long as you're about 2/3 down to your estimated working length, you'd be in good shape. That's a good emergency protocol. Then you add the calcium hydroxide, cotton cavit, or cotton and the BC liner. Probably a good idea to put BC liner in this situation, because you never know how long it's going to take for you to see the patient afterwards. So put something stronger in the axis rather than just pure cavit. And that would be a good little protocol. All right, guys, it's... I don't want to have a long one today. This is fluid. You may see me back on here again in a day or two. Do another one. Maybe I'll talk to an employment lawyer next time. We'll see. And we'll see if things change. If the Department of Public Health has any other new recommendations, I'll make sure I share it with you guys. Stay well, stay healthy, and be good in your community and with the family. And happy spring. Love you guys all. And see you very soon, hopefully at a conference in person, where I don't know if we're going to shake hands or we're going to do a fist bump with this the new normal that we're going to all deal with. But I'm sure we're going to all live through this, and we're going to tell tales to our kids and to our grandkids. And this would be an interesting experience for all of us. Love you guys all. Take care. Have a good one.